So first of all, this is of course a huge milestone, right? It's super important. The vision data published in New England Journal really showed in the so-called at least third line setting after chemotherapy and after a novel anti-androgen, to be very effective. I think this is very important. It's a big milestone. There are two things which are come next. So first thing is we try to move the therapy into earlier lines. And as you see, there are a couple of different studies already ongoing, like the PSMA addition trial. We will see more PSMA compounds. There's, for example, the SPLASH study or the ECLIPSE study, which use not PSMA 617, but PSMA INT. We will see new radionuclides. For example, instead of lutetium, there's most likely going to be also an alpha emitter, like, for example, actinium. This is one big block of development. And the second one is we hope that this is a platform technology, which can be expanded beyond PSMA, beyond prostate, and hopefully tackle quite a few of different solid tumors.